to go, P. Venice. Are we allowing participants now?
Abhina, you can start.
Abhina, you can start.
Okay, fantastic. Thank you so much. Hello, everybody. Welcome. This is Abhina Aher. I'm working as consultant with APCOM Foundation for. I'm also happen to be LGBTI activist in Asia Pacific region. I'm so proud and happy to be part of today's webinar. I'm your host for this back-to-back two webinars, which are fantastic webinars. The first one is going to focus on trans health, SRHR issues, and second one is going to be around there are some housekeeping rules that I'm just make everybody aware about. If you are joining, please make sure that you rename yourself um, with name, organization, and which country you are from. You have options where you can go a list of the participants and you can rename yourself. The webinar that are going to be um, each of the webinar we will have a gap of 10 minutes to take a break. This session has been recorded for this and will be available in future YouTube channel as well. Please keep your microphone on mute all the times unless you are speaking. We really have allocated time for question and answer. In case if you want to ask questions, please raise your hand before you speak so that we can allow you to go up and function speakers are encouraged. That is in this point because that saves time.
Abhina, so sorry, your voice is breaking. I think you should off your camera and then you speak.
And the idea is to collaborate. Hello. Yeah. You can always encourage the young speakers. There are a lot of young speakers that will be speaking for the first time here, and also they are from the different regions. So it would be really nice if you can give them a lot of encouragement. If you want to tweet or take a screenshot of today's session, please permissions from the contributors just be respectful towards each other, speakers and participants. Everybody feels safe. There are diverse people who are joining these platforms, and all of them might be not out and open with their sexuality, with their genders, or with their identities in their own respective countries. So just keep that in mind and make sure that you respect everybody. So that's it. These are the housekeeping rules. Thank you so much, and good morning, everybody. Good morning, good afternoon, good evening, depending on which part of the country you are, and welcome to the session. We are going to take a group picture now. So I'm gonna request everybody to switch on their camera for say 2 to 3 minutes and give a big smile. And from APCOM, Mrs. Selvan Anthony, who's also a senior program officer, and Mr. Vanessa, who will help us with taking the picture. Selvan, would you like to also quickly introduce yourself, and maybe Venice also, you can just quickly introduce yourself. That would be really kind. Selvan is helping us with also note keeping. Thank you so much, Selvan. You are such a help.
Thanks, Sabina. So, hi everyone. Good morning, good afternoon, good evening, wherever you are. So, my name is Sylvan Anthony. I'm working in APCOM in the programs team. Thank you so much. I hand over to Vanessa. Vanessa, over to you.
Hi, it's Dennis here. I'm the communication manager at APCOM. Nice to see you all.
Thank you. Can we just take a group picture, Venice? So should we just smile?
Okay, one more. Ready? 1, 2, 3. Okay, one more. Yes. Please open your camera. 1, 2, 3. Smile. Okay. Thank you so much. Back to you, Abhinav.
Thank you, Rakha, Venice, and for saving my internet, I'm going to switch off my camera. Apologies for that. Thank you so much, Venice. Venice is such a help always, 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 always. So thank you so much. And I'm going to request now Sylvester Merchant from IPPF, who's a regional community engagement and networking lead. I know them personally as a fantastic community advocate in Asia Pacific region, global lot on LGBTI issues, also on IPPF SRHR issues. And also they are one of the founder member of a very prestigious organization, LGBT organization called as Laksha Trust in Gujarat. So lot of feathers, Sylvie. Please, would you be able to kind enough to give us the opening remark for the sessions? Thank you so much. Over to you.
Thank you, Abina, and you know, warm welcome, everyone, and uh, especially thank you so much, APCOM, for giving this platform. I'm Sylvie. I also go by the name of Sylvester Merchant, and I'm from International Planned Parenthood Federation, South Asia region. It is my pleasure to warmly welcome you by kickstarting Stirring the Current community discussions to highlight trans persons' SRHR needs. The first in the series of webinars focused on advancing knowledge and awareness among LGBTQI communities regarding sexual and reproductive health and rights, and creating stronger evidences for SRHR needs of the LGBTQI population in Asia Pacific region. You know, my organization, International Planned Parenthood Federation, IPPF's new strategic approach strongly emphasizes on LGBTQIA inclusivity under our global SRHR initiatives. Our strategy is dedicated to promotion of health for all and addressing the existing gaps in services for young and vulnerable key population, which includes LGBTQI individuals, through comprehensive programs worldwide supported by our 4 strategic pillars, which is center care on people, move the sexuality agenda, solidarity for change, and nurturing our federation. Actually, as a part of our commitment of IPPF and its member associations to improve sexual and reproductive health related services for all, including people of diverse sexual orientation and gender identities, International Medical Advisory Panel, also known as IMAP, has developed a statement on access to gender-affirming hormone therapy for transgender and gender diverse people. This statement of hormone therapy basically for trans and gender diverse people complements and builds on the earlier IMAP statements, including IMAP statement on hormone therapy for trans people, 2015, sexual rights and sexual health services, and sexual health and rights of adolescents and young people. In these statements, I feel IPPF explicitly explored the sexual rights and health of people who are LGBTQI and intersex, and described how to provide non-discriminatory and essential health services required by communities. Actually putting that into the ground from a statement, basically, if we look at increasing number of our member associations, some, like Nepal and India, have actually started providing gender affirming hormone therapy in the trans clinics, which are housed in our member associations. These clinics also have HIV, SRHR, beautification services, all kind of, grouped into one, I would say, one-stop center.